November is Alzheimer's Awareness Month. UofL Health's Dr. Robert Underwood is with us this afternoon to go over some of the signs and even some preventative measures. We thank you so much for coming on today.
Thank you for having me.
So let's talk a little bit about dementia. What exactly is dementia?
Sure. Dementia is a term we use to describe two things, really. Number one, there's been a significant loss or a change in someone's thinking abilities, or it could be their behavior or personality. And number two, that change is so bad that they're no longer able to do things at home like they used to be able to do on their own, like take medications, pay their bills, drive, remember appointments, things of that nature.
We know that can certainly be scary if someone starts to notice things like this. What are some of the symptoms people might see?
Sure, yeah, that's a good question. Memory loss is the most common symptom we hear about. And that can be seen in Alzheimer's dementia, but it's also a very common part of getting older. And common in many other symptoms or many other conditions too, medically or psychologically. We also see changes in attention, problem solving, concentration, processing speed, decision making. And those types of symptoms can be seen in dementias such as Lewy body dementia, Parkinson's dementia, vascular dementia as well. And then lastly, changes can occur in speech and personality. So someone might not act the same as they used to. They might be more impulsive, they might be more withdrawn. And those can be seen in the setting of frontotemporal types of dementias that affect the frontal lobe.
So if people start to notice this, what are some of the steps they might take if they're concerned about dementia?
Sure. The first thing I would suggest is they talk to their primary care doctor or a neurologist, and they can order different diagnostic tests like MRIs, brain scans, blood work, because we always want to rule out treatable causes first, like infections or inflammation, medication effects, sleep disorders, depression, anxiety, things like that, all of which can cause memory problems and cognitive difficulties. And then if they're still concerned about dementia, we may see them in our clinic for neuropsychological testing of their abilities. And then the neurologist might start them on medications, of which there are several. It doesn't prevent the disease from progressing, but it does slow it down a little bit. But in general, we encourage people to stay active, stay healthy, sleep well, manage their diabetes, high blood pressure, high cholesterol, and also get support for themselves and the family.
Good tips that everybody can live by.
Thank you, yeah.
Thank you so much for coming on. We really appreciate it.